Joining us live now to talk more about the options available to women, Dr. Rebecca Kaltman, a medical oncologist at George Washington Medical Faculty Associates. Dr. Kaltman, good to have you with us on WTOP. I think as people hear the news this morning and are digesting what Angelina Jolie has done, it might sound like an extreme measure, but it's also a very courageous one. Talk to us about how common it is for women now to make this decision.
Right. Well, thanks for having me. So let me just put this in context. Ms. Jolie was diagnosed with a BRCA1 mutation. So we all have BRCA1 and 2 genes, which function normally as tumor suppressor genes, and it's mutations in these genes that end up leading to an increased risk of breast and ovarian cancer in these women. In terms of the population, only about 5 to 10% of all breast and ovarian cancers are actually caused by one of these genes. One of these gene mutations. So women who are diagnosed with one of these mutations have about a 60 to 80% lifetime risk of developing breast cancer. So this is far from the general population. The general population's risk is about 12.5%. So because of her significant increased risk, she made this decision to kind of preempt it, to not wait for a diagnosis and go for prophylactic surgery. The prophylactic surgery is very effective. It reduces the risk of developing breast cancer in these women by 95%. But there clearly are other options for women who are carriers or are at increased risk for breast cancer for other reasons beyond preventative surgery.
Can you talk about some of those other options for women who opt not to have preventative mastectomies?
Absolutely. So we follow many women who are at high risk for breast cancer, either because they carry one of these gene mutations or have a very strong family history without the gene mutation, or other factors that put them at increased risk. And so we counsel them about several options. So preventative surgery is definitely one. Surveillance. So we are here at GW a team of breast specialists, all female breast specialists, and we do risk-based screening. So some women's risk are about 60 to 80%, like these mutations carriers, but there are a lot of women that we see that fall in the moderate risk category, 30 to 40% lifetime risk. And, oftentimes surgery is not even something that we discuss as an option.
What do you discuss as an option?
So surveillance,
so surveillance is mammograms, ultrasounds, MRIs, perhaps, that kind of thing? But
at GW, we also have some novel types of breast imaging, like 3D ultrasound, that are not available in other places. And those modalities, especially some of the functional modalities, like MRI and something called breast-specific gamma imaging, helps us detect things that might be missed on mammogram, particularly in women who have dense breasts. And a lot of the women that are at higher risk are younger women who tend to have dense breasts. So we can enhance the surveillance that we do by adding to the conventional imaging, by adding to mammography and ultrasound. We also have risk assessment discussions where we talk about what we call chemoprevention, which is not chemotherapy, but it's medications to help reduce the risk of developing breast cancer, and that there are several FDA-approved agents that will reduce the risk of developing breast cancer by as much as 50%. So before we even do any type of surgery, we have plenty of options to not only pick a breast cancer up early, but also to detect it early, or to help prevent it in the first place by taking medication.
Doctor, thank you so much for laying out the options for us as we hear this story today about Angelina Jolie. Dr. Rebecca Kaltman is a medical oncologist at George Washington Medical Faculty Associates.